Good afternoon. This is Dr. Owens with AskDrO.com. I want to talk to you about something that's very, very serious in our community. It is the new synthetic marijuana called K2 or Spice. That's the new synthetic marijuana. Just to give you a little case vignette, just say you have a 15, 16-year-old athlete that comes into your office or to the emergency room complaining of chest pain. Immediately you want to rule out cardiac issues, but you start asking some basic questions like, are you taking any medications? Or you smoke anything? Did you drink anything? Do anything differently? Most of them will tell you actually no. Let me tell you about K2 Spice. K2 Spice is a form of marijuana, and it's synthetic. And therefore it causes a lot of cardiovascular issues, and it can even cause some EKG changes. So when you have this patient come into the emergency room or into your office, you immediately want to do a urine drug screen to see if there's any amphetamines or anything that would actually speed up the heart, benzos, amphetamines, other kinds of things. So what you get your UDS back, urine drug screen is actually going to be negative. But however, what you'll find out is K2 and Spice does not show up on a urine drug screen. So what will happen is you'll have a person that's presenting in your office who actually has these issues, but you won't see it. But because of the chest pain, you're probably going to admit that patient in the hospital. What you're going to find out in some cases is that the chest pain is going to become more progressive, and you can get EKG changes, but you will not always get EKG changes, and sometimes you will, sometimes you won't. But if this happens, you're going to have to go in and ask some very, very clear-cut descriptive questions about what's actually been going on. Here, number one, K2 or Spice, it is not for human consumption. It is an incense that people kind of manufacture illegally. You can get it on the internet. You can get it sometimes in illegal places, but it's a really, really, really bad drug. People smoke it just like marijuana. So you may see someone downstairs on smoking what they call a blunt or smoking a joint or whatever, when really it's actually K2 or Spice. Now keep in mind there's something called K9, which is a stronger and more potent form of the actual K2. The other thing is there's not very much in the medical literature about K2 at this juncture. This is a kind of new synthetic drug. If you get some of our common literature, you're not going to find a whole lot in it about that yet. But it is something that's very, very concerning. Couple of facts. Are there other names for this? First of all, K2 or Spice is what you call a bath salt. The other names are Ivy Wave, Purple Wave, Red Dove, Blue Silk, Zoom, Cloud, Ocean Snow, Lunar Wave, Vanilla Sky, White Lightning, Scarface, and Hurricane Charlie. That kind of gives you a summary of how intense this drug actually is. These K2 and Spice are what you call synthetic marijuanas. People spray spice onto incense, and these products are sold in smoke shops, head shops, and even in internet or other illegal kind of drug places where you want to really be very, very careful. They're very dangerous. These medications affect behavior, judgment, health, and they can cause serious elevations in heart rate, blood pressure, anxiety, hallucinations, paranoia, chest pains, and they can often cause simulation as well as suicide. So you want to be very, very careful when it comes to this particular drug. So if you have any questions, or if you think that there may be a person in your family, a young adult, a teenager, or someone even in their 20s that is using the K2 and the Spice, you want to get them immediately to the emergency room so that they can get the proper care. And if they are using K2 and Spice, not only be sure that they're seeing a psychiatrist, but they also should probably see a cardiologist. Thank you. And if you have more questions about this, feel free to hit me up at www.askdro.com. Thank you, and have a wonderful day. And I hope this has been helpful for you. And by the way, if you're having those relationship issues, don't forget to go to the site and get my new ebook called Am I in a Bad Relationship? A lot of good reading. It's hot. A lot of people are ordering it. So I want you to go out there and get your copy of this book also. Have a wonderful day.